Welcome to the Chairman's Perspective Podcast.
Welcome to the Chairman's Perspective. I'm Mark Billingsley, Chairman of the Shelby County Board of Commissioners. And today we're going to talk about Shelby County's coronavirus response. We've got a very special guest with us today, the Director of the Shelby County Health Department, Dr. Elisa Haushalter. You won't want to miss this show, so stay tuned to the Chairman's Perspective, powered by the KUDZUKIAN Network.
The Chairman's Perspective.
What children are seeing are gun violence, domestic violence, community violence, violence among the young people themselves in school and in their community.
On the KUDZUKIAN Network.
Welcome back to the Chairman's Perspective. I'm Mark Billingsley, Chairman of the Shelby County Board of Commissioners. And today we're going to talk about Shelby County's coronavirus response. I'm very honored to have a colleague and friend with us, Dr. Elisa Haushalter. She is the leader and director of the Shelby County Health Department. Elisa, Dr. Haushalter, thank you for being here.
Thank you for having me.
You have been extremely busy the last number of weeks dealing with all kind of issues, but a couple of those things are the flu and now the coronavirus, or as they're calling it, the COVID.
Yes, COVID-19.
COVID-19.
That's the official name.
We're going to learn more about that. We're going to learn on some ways to prevent getting infected with the coronavirus, and even just the flu. And also we're going to talk about not to panic, quite frankly, and just we're going to follow some best practices and and that way we can prevent being sick.
Exactly.
But before we do that, Dr. Haushalter, can we just talk a little bit about you? We were very honored. You were first appointed as the Shelby County Health Department Director by Mayor Mark Luttrell in 2016. And then you were reappointed by Mayor Lee Harris. And I can tell you, just being on the Shelby County Board of Commissioners, how grateful we are to have you in Memphis, for you to lead our health department. But originally you're from Pittsburgh,
yes,
I understand.
Pittsburgh, Pennsylvania, Steeler fan.
What? I love it. You went to Carlow University. You relocated to Nashville. You earned your undergraduate degree in nursing from Belmont.
Yes.
Tell me a little bit about your background. What got you into healthcare and nursing? I'm interested.
Well, generally people will have life experiences that shape where they go.
Right.
So I always was interested in what's now called STEM, so very interested in the sciences, and was considering being a medical doctor, a physician, and ultimately had an illness in my teen years that required that I have surgery. It was a congenital disorder. But as a result of that, I actually experienced nurses a lot, including nurses who made home visits and had a lot of experience with the public health system because the visiting nurses were public health nurses. And so I changed my mind and decided that I would prefer to be a nurse rather than a medical doctor, and actually got accepted into Carlow University in the 11th grade. And so really had my path set probably by the 9th grade. I knew which direction I wanted to go and have continued in that path. And both my undergraduate and my graduate degrees are all in nursing practice.
Man, that is amazing. So really your own health experience shaped you going into nursing and into healthcare.
Yes, and really into public service. So having public health nurses visited me at home helped me understand the role of the public health nurse. And also being in an inner city community, I interfaced a lot with public servants. And then I share with people, given that there are summer jobs here that go through the mayor's office and the commissioners.
Sure.
My first paid job was actually through a mayor's summer jobs program. My older brother and I both did that in the early 70s. That was very common to offer jobs to inner city youth. And so that's one of the reasons I went into public service.
That's amazing. Well, you've got an unbelievable background, an unbelievable resume. In 2017, the Tennessee Nurses Association gave you the Nursing Excellence Award in Nursing. 2017, the John Runyon Jr. Community Nursing Leader Award. And then in 2018, right here in Memphis, you were part of the executive class of Leadership Memphis.
Yes.
Well, again, we are honored for you to be here. We'll talk about some other things, but I know today people want to know more information about Shelby County's coronavirus response. Can you start, Dr. Haushalter, just telling us a little about what is the coronavirus? What is COVID-19?
Yes. So coronavirus or COVID-19 is something that we call a novel virus. And novel is just that. It's new. It's a virus that was recently discovered. It started in Wuhan, China, end of 2019, so December of 2019. And why it's important that we really understand that it's a novel virus is that we're learning new information every day. Coronaviruses are a group of viruses. Many people are familiar with SARS. They remember that, or MERS. They were both coronaviruses. They were also at that time novel viruses. And so we are not only preparing for it, but the research community is also studying it to determine what are the best methods to diagnose, treat, and prevent the spread of coronavirus.
Wow. You're listening to the Chairman's Perspective on the KUDZUKIAN Network. We're with Dr. Elisa Haushalter. She's the director of the health department. Dr. Haushalter, what are the symptoms of the coronavirus, and is there really any way for a lay person to tell the difference between a common cold, a flu, or the coronavirus?
So there's a combination of things that we look at to determine if a person is at risk of possibly having coronavirus. One is the signs and symptoms. So about 80% of individuals who have coronavirus do not have symptoms, or they're very, very mild. Then we have another small percentage that are ill, and then even a smaller percentage, somewhere between 5 to 8%, that are sick enough to go to the hospital or to seek emergency care or medical care. And those individuals have what you would expect, a fever, runny nose, cough. But over time, they generally develop pneumonia, which is a very deep cough, difficulty breathing, could even have pain with breathing, and then a worsening fever. But the other piece is the history. Currently, most people have had connection to somebody who's traveled to a site that has transmission of coronavirus. So we rely heavily on, right now in the United States, what someone's travel history is and have they potentially been exposed.
Well, are you seeing any cases where someone didn't go to China or didn't go to Italy or some foreign place where we've got current cases, where they just picked it up nationally here locally?
So Seattle, they don't have a source for that or contact from the initial infection.
Sure.
And then one other part of California. So there's belief that there's some community transmission, although I understand they're doing additional investigation in California and may be able to link their initial case with an outbreak elsewhere.
Wow. Dr. Haushalter, and this show doesn't air live, so we may be a few days off when this hits. But today it was announced that we have our first case of the coronavirus in Tennessee. Is there any new information about that one case?
Well, what I understand, and let me talk a little bit about how our public health response is.
That's a great idea.
It helps people understand what's happening with the case that has been diagnosed.
Yes.
Okay. So initially what we try to do is prevent the virus from coming into our community.
Okay.
So that's where you see the travel restrictions. The next is when you have a case, and there's still in very small numbers, that case is identified quickly, isolated quickly, all of the contacts identified, and those contacts quarantined so that we contain it. Once there becomes significant spread, it's more mitigation. So in Williamson County, there's one individual that's a case. That person's contacts have been identified and they have been quarantined.
Okay.
So the current focus is to contain that within that very small group of individuals, knowing that others may get it from that initial case. My understanding is that at the current time, there's not a known risk factor for travel, but they're still doing the history on that individual.
Very good. We're going to be right back on the Chairman's Perspective. Today we've got Dr. Elisa Haushalter with us, the director of the Shelby County Health Department, and today we're going to talk about Shelby County's coronavirus response. We're going to be right back on the Chairman's Perspective.
The Chairman's Perspective on the KUDZUKIAN Network.
Jazz, America's own original musical art form. When did it start? Who were and are some of the major players? How do you distinguish what kind of jazz you're listening to? We talk about the great and lesser-known artists, songs and tunes, the instruments, and the social impact jazz has had on world culture since its beginning at the start of the 20th century.
Riffin' on Jazz on the KUDZUKIAN Network. KUDZUKIAN!
Welcome back to the Chairman's Perspective. I'm Mark Billingsley, Chairman of the Shelby County Board of Commissioners, and today we're talking about the coronavirus and Shelby County's response. We've got Dr. Elisa Haushalter with us from the Shelby County Health Department. We were just talking about the one isolated case at this time in Nashville, or in Williamson County, I think.
Yes, Williamson County.
But Dr. Haushalter, We've talked a lot about just individuals' responses, and we'll get into hand washing in a minute, but I assume you've got other broader partners that are working with the Shelby County Health Department. Can you tell us a little bit about that and how even businesses are responding to this?
Sure. And I always will point out that public health can't keep the community healthy by themselves. We really rely heavily on partners, and that's everywhere from hospital partners to other healthcare providers like clinics, urgent cares, federally qualified health centers. We rely heavily on partnerships with the academic centers, schools, and businesses.
Wow.
So for the last probably 6 weeks, maybe 5 weeks, but somewhere around 5 or 6 weeks, we have been either doing outreach to specific partners or they've been reaching out to us. An example may be FedEx. They fly internationally. They also fly to China. So they reached out to us early to be able to see what they needed to do to make sure that their pilots remained safe and that if someone was at risk, what they could do. And they're doing exceptional work to make sure that their pilots remain healthy and safe. We've had a lot of calls from academic institutions, particularly as we go into spring break.
Sure.
Should there be travel restrictions if people have traveled abroad? Should they be furloughed or allowed to stay at home afterwards? One of the things that's specifically important, particularly in academic centers, but also in the business arena, it's important that people who are sick, we're still in flu season.
Right.
That people who are sick don't come to class or don't go to work. And so that means changing policies or revisiting policies, and our partners are doing that. The other thing, particularly here in Memphis, as we go into the event season, is our hospitality partners. And we have met with the hospitality partners earlier this week to look at things that they can do. Many of them are already doing wonderful work to keep surfaces clean, reduce buffets where people might touch utensils and so on, to be prepared in the event that we have a case here. And I really commend them for the work that they are doing. Then we'll be meeting with other elected officials tomorrow to talk about the role of our municipal mayors and how they can get information out to their constituents and their community members.
Well, that is amazing information, and it certainly does speak to what you said earlier about the Shelby County Health Department cannot do it by itself, and it's exciting to hear, quite frankly, as concerning as the virus might be, that you've got so many different people working sort of proactively to prevent any spread of the virus, or honestly just the plain old flu that's nagging us this time of year.
Yes.
What's the flu been like this year and compared to other years? Is this a high year for the flu? Or
what's been interesting this year with flu season is we've had both flu A and flu B circulating at the same time, and typically you have one that'll kind of fade out. You may have a little bit of overlap, and then you have the second wave. So we still have flu A and flu B circulating in our community, and we anticipate that we will have flu all the way through April. And so we have to keep in mind that any of things that we're talking about as far as keeping healthy and preventing the spread of respiratory diseases like coronavirus applies to the flu as well.
Wow. Again, we're with Dr. Elisa Haushalter, Director of the Shelby County Health Department. We're on the Chairman's Perspective on the KUDZUKIAN Network. We have not talked about prevention, and it's so simple to do. Dr. Haushalter, can you take us through those steps and even the proper way to wash our hands?
Sure. So keep in mind that coronavirus is a respiratory virus. It's spread very, very easily, and it's spread through coughing and sneezing, but more so it's through touching and surfaces. If you just pay attention during a day to how many surfaces you touch with your hands, and then how many times you put your hands to your face, that oftentimes we're picking up respiratory germs by our hands and our face. So the most important thing that we can do is wash our hands.
Okay.
Soap and water is ideal. Like disinfectants that you can buy and other hand washing products, they're really a backup, and you can use them, but soap and water is the best, and you have to wash your hands for at least 20 seconds.
Oh, that's good to know.
And you have to wash them, you get a good amount of foam worked up, and do it at least for 20 seconds, and then completely rinse your hands. And it's one thing that we take for granted, but we generally don't do well. And so that's one of the most important things that we can do, not just for coronavirus, but in general.
My background is in healthcare.
Yes.
For a decade, I worked for a hospital foundation. If you work in a hospital, you learn to properly wash your hands. And even some things I think lay people may not be aware of is after you wash your hands and you've dried your hands with a paper towel, take that paper towel and close the water off. And then I usually use that same paper towel to open up the handle of the door of whatever restaurant I'm in, and then I throw the paper towel away. Is that
so? That's a technique we oftentimes learn. The one thing that's important is you have to do that with a dry paper towel.
I did not know that.
So if your paper towel is soaking wet when you've washed your hands and you put it on the handle to turn the water off, you're actually wicking up the germs.
I did not know that.
Yeah. So it's important if you do it, you really do it with something that's dry and then, discard it.
Boy, I learned something new today. I've been doing that wrong for a while.
So the one thing nurses learn, we do learn how to wash our hands.
Yes, you do. Well, I've been doing a pretty good job, but I don't know if I've done it that well. I thought I was doing great by using the paper towel to open up the door, but it needs to be a dry paper towel.
Yes.
We only have about a minute and 30 seconds left in this segment, and we're going to come back and talk about the website, www.shelbytnhealth.com.
Yes.
Again, that's www.shelbytnhealth.com. And I was just blown away, and we'll talk about this in the next segment, Dr. Haushalter. But you've got information on there for healthcare providers. You've got information on there for individuals, for people in the community, for businesses, for schools, and even for people that are planning events.
Correct.
What's on the website related to the coronavirus?
So one of the things that we have to do is stay current. I really want people to stay current and also to get information from experts. So much of the information that we have is produced by the Centers for Disease Control. There's no need for us to recreate the wheel, but to actually get that information to our community in a user-friendly way. So that's why our website is there. And we will continue to add materials as they become available.
Wow, that's great. So you're updating it literally at sometimes several times a day.
Several times a day, yes.
Because it seems to be an ever-evolving story. So we're going to be right back on the Chairman's Perspective. I'm here with Dr. Elisa Haushalter. We're talking about Shelby County's coronavirus response. Seems like we're doing a pretty good job so far. So we'll be right back with Dr. Elisa Haushalter.
The Chairman's Perspective on the KUDZUKIAN Network. The Chairman's Perspective.
What children are seeing are gun violence, domestic violence, community violence, violence among the young people themselves in school and in their community.
On the KUDZUKIAN Network.
Welcome back to the Chairman's Perspective. I'm Mark Billingsley, Chairman of the Shelby County Board of Commissioners, and today we've got a great colleague and friend, the Director of the Shelby County Health Department with us, Dr. Elisa Haushalter. And we've been talking about Shelby County's coronavirus response. It's been unbelievable how many things you've done with the partners we've discussed today. We've also talked about flu A and B is still going around, and it'll be around till April, so it's really important we continue to wash our hands. And I just learned a little while ago I haven't been washing my hands properly, and so I'm going to try to work on that.
Okay.
Let's talk just briefly. We didn't talk about this, and I've had friends ask me recently because I work at a university, and we have different people coming in and out. The countries currently with countries with travel health notices regarding the coronavirus, what are the countries that we need to be considerate of if we're thinking about traveling?
So first thing I'll say is stay current. So really look to the CDC website because they're updating those lists every day.
Okay.
And there's various categories, category 4 through 1, and people need to understand what category a country falls into, and the precautions are identified relative to that. So the main countries with ongoing transmission, still mainland China.
Okay.
They added South Korea to the list, Italy to the list, and Iran to the list.
Wow.
And some people I know are, like Italy, this time of year, people go for spring break. Some to Iran, but probably less. So those are all countries that, one, you would choose not to go to.
Sure.
Unless you have some essential reason to go. So non-essential travel should not occur.
Right.
And then when people come back, they're asked to really stay inside for 14 full days.
Wow.
So if someone does travel and they come back, they have to realize they can't really do anything for 14 days. They're in their home monitoring to make sure they don't develop cold and flu-like symptoms.
Boy, that's quite a while.
It is a while, yes.
Is that a longer period of time than the common flu? or is it about the same?
No, the incubation period for the flu is a little bit less than that.
Okay.
So with this particular illness, they have estimated the incubation period to be 14 days, with the peak of illness somewhere between the 5th day and the 8th day.
Wow. Around we've talked about hand washing, but I know on your website you were telling me just the other day, there's lots of disinfectants, but on your website you can go to a link and you can actually look and see, and you were sharing with me just the other day that a lot of the common household products we already own.
Right, you can use those. But there's an FDA-approved list to encourage people to look at that list just so they're comfortable that they're using products at home that actually will kill the virus. And it's important to clean surfaces on a regular basis. That is especially applicable in school settings, business settings, obviously hospitality industry, daycares, and so on.
Okay. Let me ask you this. There's been a lot of news lately about cruises and people getting sick. I've got one friend that had plans to go to Alaska. They feel uncomfortable traveling right now, just being in such tight quarters. So they've decided to cancel their trip to Alaska. And I've got another friend who's heading out next week to the Bahamas, is super excited about it. So I have two friends, one who's very tepid about going anywhere, and I have another friend who said, heck, if I'm going to get sick, I'll get sick there in Memphis. And so they're going to the Bahamas. Any notations from the CDC or from your department as it relates to taking a cruise or anything like that?
Currently, the focus is on avoiding non-essential travel on Asian cruises.
Okay. So not necessarily the typical Alaska cruise or the Bahama cruise or to Grand Cayman, you're probably going to be fine. But
correct.
Any cruises out of Asia.
Right. Or going through Asia or going to that area of the world. But I also would tell people that they have to make prudent decisions for themselves.
Right.
We do know that the people most impacted by coronavirus are people who are older and people who have chronic illnesses. And so people who have chronic illnesses or who are older and may be ill, they need to make decisions that are right for them, and they can do that and consult with their healthcare provider.
Okay. You're listening to the Chairman's Perspective on the KUDZUKIAN Network. We're with Dr. Elisa Haushalter. We're talking about Shelby County's coronavirus response. I know you're probably getting these phone calls, or at least I assume you are. If I call you up today and I say, hey, Dr. Haushalter, I want to be tested for the coronavirus, you don't necessarily do that. How are people being tested? What's the process for that? So
the process is changing very, very quickly as more tests are being made available across the country, and as the FDA is loosening up restrictions on who can do testing. But the current process is typically a physician or healthcare provider, once they've seen a patient, will either reach out to us or the state health department to get permission to send the test for testing.
Okay.
There's limited capabilities currently because there's not that many tests available. We do anticipate over the next several weeks there will be more opportunities for testing. In consult with the state health department, there's a lot of questions that'll be asked to make a decision if that person needs testing or not. We have quite a few people who call us and give us their background. They want to be tested. They don't really meet criteria for testing, but we will try to help them and coordinate for them to go in and get seen. And most everyone thus far, no one's had coronavirus.
That's great.
But most have had flu.
But again, we were talking, we've got a little bit of time left. What's really important is, right now, almost everywhere throughout Tennessee, you're going to be fine. There's only one limited case that's being suspected in Tennessee. But it's really important to remain calm. And how would you talk about just your mental awareness of the virus and not sort of overreact?
Right. It's important that we stay calm.
Okay.
And make sure that we're doing good hand washing, which we talked about earlier, not touching our face and hands, keeping a distance from people, and not being too close. But also, it is really, really important to stay home if someone is ill. Where that makes it difficult, and this, again, business decisions that need to be made, is many individuals who are hourly workers, if they don't go to work, they don't get paid.
That's right.
And so it's going to be very difficult for people to stay home, but we can't reinforce that enough. There has been some discussion that you can spread coronavirus even if you're not sick, and that's true.
Okay.
But the truth is, by the time you're coughing and you have a fever, you're more virulent and you're more likely to spread it. And the same applies with the flu. So if you have a fever, you should stay at home and be fever-free without any medication for 24 hours before you go back to work or have your child go to school.
You know, none of us really like that one employee who says, I just can't miss work today, but they come in with the cough and the fever and everything else. And that's true of lots of illnesses. And, parents that'll send a sick child to school, it's not in the child's best interest or the employee's best interest or the people they're around, correct?
So it's really about setting a workplace environment that you support people so that they can stay home and take care of themselves.
Absolutely.
Personally, my team members will tell you if I hear them coughing and they look feverish, I'm going to tell them to go home. We have to practice what we preach.
I don't blame you. Well, Dr. Haushalter, we've talked about a lot of really interesting things today. Thank you for the response you've had with the Shelby County Health Department as it relates to the coronavirus. Thank you for all the things that you do each and every day. You've got a dynamic team at the Shelby County Health Department.
We do, thank you.
I mean, you really do. And to have your leadership here in Memphis and Shelby County is so important to us. If the best place to go for more information, like we've talked about today, is, will you repeat it? It's
Shelby TN Health.
That's
if they
easy.
Google Shelby TN Health, our website will come up.
And a lot of those things we talked about, cleaning supplies or symptoms and everything, or even a link to the CDC you can go through,
is on that site.
That's
definitely.
really, really good.
And if someone has a question, they can email us a question and we'll respond by email.
Very good. Well, we'll have you back on the show when we're going to talk about something else. We'll maybe talk about summer something or best way to stay healthy in a pool or something funner than this.
Something more fun. Thank you.
Well, thank you so much. You've been listening to the Chairman's Perspective, and we'll be right back.
Keeping it real, right, and funky.
Mauricio Caldwell, who happens to be the executive director of Latino Memphis. Welcome to Funky Politics, sir. How are you?
Great. Thank you. You're having as much trouble saying my name as I do saying KUDZUKIAN, so we're even.
Hey, look, I'm good on that.
Yeah. Reasonable people understand that a country is more than its leader. I mean, I love my home country, but I think people in Memphis need to count their blessings.
Funky Politics on the KUDZUKIAN Network.
Thank you so much for tuning in to the Chairman's Perspective. Today we were very happy to have Dr. Lisa Haushalter, the director of the Shelby County Health Department, talking about Shelby County's coronavirus response. A lot of very useful information. And just to remind you, if you want more information about this topic, please go to www.shelbytnhealth.com. Again, www.shelbytnhealth.com. Until next time, this is Mark Billingsley for the Chairman's Perspective.
The Chairman's Perspective Podcast. Executive producer, Shelby County Commission's Chairman, Mark Billingsley. Directed, produced, recorded, and distributed by KUDZUKIAN.
The Chairman's Perspective.
What children are seeing are gun violence, domestic violence, community violence, violence among the young people themselves in school and in their community.
On the KUDZUKIAN Network.
KUDZUKIAN.